Okay, Lauren, thanks very much. Well, most people in Maryland who get the Pfizer or the Moderna coronavirus vaccines have been following through and getting both shots, but there is still a small percentage of people who don't get the second shot. WMAR 2 News' Mark Roper's outside M&T Bank Stadium, one of the mass vaccination sites. So, Mark, why do health officials think some people have been skipping that second dose?
Good morning, Christian. Well, people have many different reasons for missing that second dose, but here in Maryland, more than 90% who get their first shot do actually go ahead and get that second shot of either the Pfizer or Moderna vaccine, and it's actually better than the national average of 88%. But still, health officials have a message for those people who missed their second dose, and that's it's still not too late.
A COVID vaccination appointment is highly coveted by thousands of people in Maryland. Yet some people who get their first shot of a 2-dose vaccine don't get their second.
The vast majority of people are getting it. There are a few, and I would imagine it happens for every reason that we could imagine, that we all miss every appointment. I couldn't make the schedule. I forgot. I tried. I know you sent me reminders.
Perhaps everyone's heard that maybe the second shot, you have a little bit more side effect than the first shot. But when I'm talking to people about the vaccine, I always say, would you much rather a little bit of flu-like symptoms for just about 12 to 24 hours, then it goes away, and you be protected against COVID versus still potentially being at risk for COVID?
According to a recent CDC report, more than 90% of people who get their first shot in Maryland get their second shot within the proper time frame.
We're hoping that the numbers show, we're doing a great job as a nation and our systems are working, but we know there are a small number of people who are getting their second dose too early. Or aren't coming back at all.
I don't want anybody to think, oh, well, I missed it, so therefore I shouldn't go. No, please go get it. Reschedule it if you missed it, but definitely go ahead and get the second dose.
And for those who forgot, had second thoughts, or missed their appointment,
we also want to remind people that that Pfizer and Moderna, although it's recommended at the 3-week and the 4-week interval, that the CDC has expanded that to 42 days.
We really recommend that 42 days is kind of the outer limit of what CDC recommends. But still, there is not a need to start the second dose. Start a series again, instead just come back and get that second dose. If delays are unavoidable, come back anyway.
health officials say it's not too late to reschedule, but sooner is better than later.
Just want you to get your second dose anytime. It's really talking about the efficacy. When does it start losing? They're touting their 92%, 94% efficacy. When it gets past those 42 days, they're finding that it's a little less efficacious, but we still want you to get it.
Now, of course, the Johnson & Johnson vaccine only requires one shot, which makes it easier to schedule only one appointment. But health officials want to reiterate that all 3 vaccines are effective and that you should get whichever shot becomes available. Reporting live outside M&T Bank Stadium, Mark Roper, WMAR 2 News.
Okay.